Hello, and welcome to Drug Residue Testing Program Requirements. My name is Lisa Roscom. I'm one of the Laboratory Evaluation Officers with the Division of Food and Recreational Safety in the Wisconsin Department of Agriculture, Trade, and Consumer Protection. Along with Nancy Smith and Kate Angelis, our other Laboratory Evaluation Officers, and Supervisor Laura Tross, we welcome you to this workshop. Let's first talk about the National Conference of Interstate Milk Shipments requirements. And that requirement is that every load of raw milk that is received in this country must be tested for beta-lactam drug residues. Now, beta-lactam drugs are the members of the penicillin family of drugs. So penicillin, ampicillin, cloxacillin, amoxicillin, and ceftiofur are all beta-lactam drugs. But what about other tests? What about sulfonamides, tetracycline, chloramphenicol, aflatoxin, or flunixin? Well, currently you are not required by the NCIMS or Wisconsin rules to test for any of these. But if you test for a chemical that does not belong in the milk and get a positive test result, you must treat that milk as adulterated under Wisconsin law. That means if you find a positive, it must be confirmed and it must be disposed of properly. Now, if you are looking for the latest and greatest 2400 forms, you can go on the Pro Board's website, and the website address is on this slide. The first time you go on the website, you will have to register, but once you've registered, you look for the form name Appendix N Tests, and then you look for the name of the form that you want. This is a PDF file, so it can be easily downloaded or printed. Now, what are the facility requirements under this program? Well, every facility that receives raw milk must be approved to do beta-lactam drug residue testing on the milk they receive, or the facility must have an arrangement which is pre-approved by the department to have their milk tested elsewhere. To be approved to do drug residue testing, a facility must have at least one approved industry supervisor, which is why you are watching this presentation. They must also meet the requirements of the beta-lactam drug residue testing program, which is what we will be talking about today. Now, to meet the requirements of the beta-lactam drug residue testing program, a facility that uses a reader and printer must have one industry supervisor submit annually an internal audit showing that their facility meets the requirements of the beta-lactam drug residue testing program. They also need to document the training and testing of all screening analysts at the facility. And remember, you must have a reader and a printer. You cannot have a reader without a printer. Now, if you're a visual read site, you need to go through an initial on-site evaluation with all the analysts before you can begin testing. Also, any new analysts that are hired must also have that on-site evaluation with one of the LEOs before they can begin testing. Analysts must also run and pass state split samples, not internal split samples. One of the industry supervisors at your facility must also annually submit an internal audit showing that their facility meets the requirements of the beta-lactam drug residue testing program every 12 months. And you need to document the training of all the analysts at your facility. As an industry supervisor, it will be your responsibility to show that your facility is meeting the requirements of the program. So we're going to talk about the state requirements, which are the internal audit, the training and testing of the analysts, as well as go through the 2400 series form. So what we're going to talk about are the testing records, so testing every load and controls, as well as the quality control requirements, which is according to the 2400 series forms. With an internal audit, this must be done every 12 months by an industry supervisor using those 2400 series forms. Also, analysts need to be trained and tested by the industry supervisor on the test procedure per the 2400 series forms, and analysts must test unknowns annually. Now, if you're a screening site, you need to have a certified lab that will do your confirmation testing. All personnel who test incoming loads of milk or screen loads of milk must be trained initially and annually. Now, training includes going through the 2400 series forms, the general requirements form, as well as the test kit form for the test that you are using. Go through any QC forms at your facility, so your refrigerator temperature records, your test kit suitability records, so they know how to fill out those forms. Also go through the positive drug residue report form so they know how to fill out their portion of this form, as well as the tanker disposal report. Industry analysts must also be tested. An analyst using a reader printer test must run at least 3 samples. One of those must be positive, one must be negative, and the third can be either positive or negative, so switch it up. So when you make up the 3 samples, label them 1, 2, or 3, A, B, C, or however you want to label them, but they must be unknown to the analyst. These analysts must correctly identify all 3 samples, and this can be done in-house. However, if you're using a visual read test, you must use state-provided split samples. And these are 8 samples from the Bureau of Lab Services, and you must correctly identify at least 7 of those samples. Now, analysts trained in this manner can screen loaves of milk. They can also verify that initial positive tanker, which is duplicate testing with positive and negative controls. What they cannot do is confirm positive loads, test producer samples, clear a positive producer, or train other analysts. Now, industry supervisors that are approved but not certified can also screen loads of milk. They can verify that initial positive tanker, which is duplicate testing with positive and negative controls, and they can train other analysts, but they cannot confirm positive loads, they cannot test producer samples, and they cannot clear a positive producer. Only certified analysts can confirm positive loads. So remember, certified means you can confirm. They can also test producer samples and clear a positive producer. Well, how do you know if you're certified? First of all, is the lab that you're working at certified? If it's just a screening lab, then no, it's not. Have you gone through an on-site evaluation? Has myself, Nancy, or Kate, one of the LEOs, come and watched you run that test? If not, then no, you're not certified. Do you have a license as a certified analyst? Is there a piece of paper from the state of Wisconsin on the wall saying that you are certified for your tests? If not, no, you're not certified. Remember, you can be approved as an industry supervisor or an IS, but you will not be certified or a CIS if you do not meet these criteria as an industry supervisor. In your packet is this Wisconsin Appendix N personnel chart. In it, it describes in a little bit more simpler form all the different things that industry supervisors and industry analysts can do. So as you can see, an industry supervisor that is not certified can screen loads, can train industry analysts, and test industry analysts. They must attend the workshop every other year, and they must do that internal audit every year. So if you look at this chart, it should help you to understand what your roles and responsibilities are. This is the end of the first presentation. Please go on to presentation number 2, General Requirements.